Transgender individuals, particularly youth, experience significant health inequalities relative to the broader population and especially in comparison to the dominant cisgender culture. These disparities are largely driven by systemic barriers embedded within a healthcare system structured around cis-normative assumptions.
Transgender people have low rates of access to health services due to a range of issues including stigma and discrimination both socially and legally, despite increased health risks.
As a result, many individuals delay or avoid seeking medical attention, increasing the risk of preventable adverse health outcomes.
For those that do seek care, inclusive services are lacking. Patients often face wait times and most clinicians lack education in trans-specific issues.
The burden of education placed on transgender patients seeking healthcare can be overwhelming. We should all take proactive steps to counter this as a part of the continuous professional development required by regulatory bodies. Respectful clinical care of transgender and gender-diverse individuals requires a personalized approach that appreciates the diversity of this population group.
The first step is to always check your bias at the door. No two people have the same story or preferences, so ask and show respect by keeping your practice patient-centered.
Do your best to avoid misgendering your patient and always ask consent before discussing their personal information with or in the presence of others.
Creating a safe and clinically responsive space requires trust. Symbolism such as rainbow badges and signage are effective indicators to patients that we can be trusted to provide an affirming environment. So always ensure that if you wear the badge, you're prepared to uphold that responsibility.
For transgender people, presentations involving a sexual or menstrual history may be highly gender dysphoric. Guided by patient preference, gender-neutral language such as pregnancy capable can avoid this. We can often make things worse through our own visible discomfort, so remember to stay professional and don't avoid talking about things pertinent to a comprehensive assessment.
Remember, safeguarding as paramedics extends beyond clinical risk. It encompasses protection from physiological, cultural, and systemic harm.
For transgender and gender diverse individuals, this means recognising vulnerabilities, avoiding biased assessment, and facilitating safe, affirming environments.
Familiarise yourself with local organisations that can provide support and empower your patient through shared decision making.
Remember, a patient's experience of your practice has a very real